and this will determine the authenticity, so it protects the patients.
When I do laser, the laser reflects off the skin.
It can address a variety of skin types, especially the oily skin type.
The earliest I've seen results without any hyaluronic acid, just the carrier inside, is 2 weeks.
As mentioned earlier, it should only be professionals using Juvelook. So I wonder, are there techniques on how to administer Juvelook, Dr. Edmond?
Yes. So there is several techniques recommended when we are using Juvelook. We can use it either with what we call the injector gun, where we load it into this specialized device that assists a doctor to inject the product into a specific preset depth into the skin at a very specific preset amount. This is my favorite technique, as it provides a very comfortable treatment for my patient, as well as a very minimal recovery time. I always tell my patient, you can basically do the treatment, put on a cold soothing mask after that, and you can go shopping.
No downtime, in other words.
Yes, very minimal downtime. And of course, there are many different ways of injecting. We can use a needle, small tiny needles with syringe and inject point by point. And of course, we can use a cannula to inject it. Again, we run frequent workshop internationally between countries to keep our doctors updated of the newest techniques required to perform this procedure safely.
I agree with Dr. Edmond. There are multiple ways to administer the product, may it be through a sharp needle, a blunt needle, or via machine. It will just really depend on what the patient needs. However, the doctor is only as good as the weapons that they have. So as a doctor, I believe that you can only provide the best treatment for your patients if you actually do a lot of training for the product. So not only do we need mastery of the science behind it, we also need mastery in learning how to administer the product. That's why I highly recommend our Filipino doctors undergo training so that the experts here with us can share their experiences that they've had the past few years in administering it, so that we're able to administer this in the safest and most efficient way possible.
That's right. You doctors go to a lot of training constantly, right? As they level up with the different products. Yeah.
I always tell my patients that we as doctors, our patients deserve the best. And we're only able to do that if we constantly keep ourselves updated. If I were a patient, I would prefer to go to a doctor who has a lot of experience in that particular product. So I think it's really the experience and the training that will ensure that the product is administered safely and efficiently.
You know, earlier it was mentioned as well, when something gets really popular, there's going to be a lot of counterfeit. So how can we authenticate Juvelook? Is there a way to ask for certification from the doctors?
So since Juvelook has been around in Singapore for a longer period, we are more aware that as it gets popular, there may be chances of, parallel imports or even counterfeits, which we really wouldn't, encourage the medical practitioner or patients to go ahead with.
Yeah.
So actually, if you look at the sticker, just to let patients know, there is a hologram here, which they can scan. I don't know whether you can zoom in to show it, and this will determine the authenticity, so it protects the patients, and lets them know if the product they are using is counterfeit. I think from a medical legal standpoint, it's very important not to use counterfeit products. More importantly, from a medical and safety standpoint, we don't want patients experiencing complications from these counterfeit products.
So we have to look at the hologram.
Yes, there is.
That's there, okay, on the box of the product. But just in case someone gets to use a counterfeit or a fake, what would be a side effect?
I think number one, like I mentioned, is the medical legality. If the doctor uses a counterfeit or fake, I don't know whether the producer, which is Vine Global, or the distributor, which for us is Elogio, will support us. So the doctor is left alone. Number two, like I said, is more a medical safety point of view. You don't know whether the products are contaminated or whether the right PDLLA or ingredient is being used. So in terms of reactions, it's so unpredictable. Anything can happen. The nodules may be one thing. You could have infections. You could have long-standing resistant infections, which will be challenging to manage, not just medically, but may even need to be managed surgically.
That is very scary.
I think all the experts here will agree to doctors and patients do not use counterfeit products.
Yes, please. No fake products. And of course, don't forget to check out the hologram on the box, okay? The patients are also probably wondering, how long will this treatment take? If it's my first time and I want to experience that rejuvenation that I've never had before, how long will it take to get to a young-looking face?
I'm very fond of knowing whether the product works by itself alone. So I've been doing a lot of split faces using PDLLA. The earliest I've seen results without any hyaluronic acid, just the carrier inside, is 2 weeks. I've seen better skin quality, but this is in an older patient. A virgin case, no treatments ever done before. She's a school teacher. She hasn't done any injectables before within 2 weeks. The patient's skin quality improved. But in patients who've done a lot of procedures, I don't see effects in one procedure, in one session. I'll see it maybe in the middle of the second session going to the third, but very subtle changes. So I would say it again, PDLLA is a product for a long game. If you use it alone, you don't see effects very, very fast. I think that's why if patients want an initial glow, hyaluronic acid is mixed together with a good quality, not counterfeit product. But within itself, I see it after maybe a good number would be 3. For the peri-orbital rejuvenation, I also did a split. Other products would have that initial oomph because of the content, especially if the hyaluronic acid is cross-linked. If you're after the volume, you'll definitely see faster in other products, but that is expected. If you're after the quality of the skin and the fine wrinkling, the texture, then I think sticking with PDLLA will give you more beautiful results later on. But I think we have to hear from the periocular expert.
That's right. Yeah, as I mentioned I'm an oculoplastic surgeon, so I do a lot of periorbital rejuvenation, both surgical and non-surgical. I think PDLLA works great in the periorbital region because we have very little injectables to play with. Anything above that tear trial where the skin becomes extremely thin, it's the thinnest part of the body. But with PDLLA and how we know we've injected in the right planes, we've found that over time, like Dr. Elaine mentioned, we're not chasing the volume, because what we want is to thicken that skin, improve the quality and the elasticity and the collagen in the lower lid, even the upper lids, and where the crow's feet area is. So you get healthier skin around the eyes. And since I do a lot of blepharoplasties as well, I've been using it as an adjunct. I always tell surgeons, you can excise skin, you can excise fat, you can reposition fat, but you can't change the quality of skin with your surgical skills. But now with injectables, we can actually enhance our surgical results as well.
Speaking of results, how long does Juvelook last?
The onset of Juvelook is later compared to the hyaluronic acid that you basically replace the hyaluronic acid into your skin. So once it's onset 2 to 3 weeks later, often it can last up to about a year to 1.5 years. But of course, many patients, they just want more and more. Like there's no limit to beauty, right? So we have had cases that we have done monthly treatment with Juvelook, and I remember this one case where her skin literally looks like glass. When I do laser, the laser reflects off the skin Yeah. So this is the comment that I given her. I said, wow, your skin really a glass skin, because when I do laser at a certain angle, the laser reflects off the skin.
It's actually, we all want that. It's actually a dream of a lot of people.
I agree with Dr. Edmond. We see initial results 1 month after. However, we see sustained and better results as we do the second and third session. I do find that for best results, multiple sessions are needed, and these results may last you up to a year and a year and a half.
Okay, and then after that, you can
Do a touch again. The best way I would describe it to my patients, for our Filipino patients, it's like filling up your car with gasoline. So if you do sessions of Juvelook, it's like putting some more gas into your car. So what happens if your gas is full tank? Performance is good. So as the time goes by, your gas goes down. So it's time to refill again, so you can have the maximal performance of your car. So it's the same way with Juvelook. We do some touch-ups just so that we are able to give you the best results that we can.
Exciting. Okay, this was mentioned earlier, energy-based devices. So do you advise Juvelook with other energy-based devices or laser?
Yes, I would definitely combine PDLLA with other approaches. I was just talking to Dr. Edmond about combining PDLLA with energy-based devices. It's not only fine, it will make the skin's quality even better. Okay, the energy-based devices we have here in the Philippines are ultrasound-based, HIFUs. We have RF-based. The science behind it is that the molecule of PDLLA has a glass transition temperature. At a certain temperature, it transitions from its less crystalline amorphous structure, and then it starts to degrade. We want that because it's part of the safety profile, right? But in higher temperatures, it starts to degrade faster. There are other products like PLLA that are less degradable by enzymes. Now, if you introduce a lot of high temperature devices, then the degradation process might be faster. Okay, so if you'd like to combine it, the suggestion of the expert is that you can do a HIFU first, because the temperature is a little higher, and then you don't achieve the glass transition, and then you can do the PDLLA treatment afterward. If it's an RF procedure, then you can do RF first, or you can do PDLLA first. Is that right, Dr. Edmond? Yeah, so, but if you've had a PDLLA treatment and you've undergone HIFU treatment, that's no problem at all, okay? Because the medicine has been introduced already in the skin. It already can act as a scaffold, and you just wait for your next PDLLA treatment again.
So it really takes a professional to know how to mix all these procedures, right?
Yes. Actually, a lot of studying from the doctor side, and also now these days from the patient side as well.
In Korea now, there's this, I would not say trend, but tendency for doctors to do 5, 6, or even 7 types of treatment, or 8 types of treatment in one go. So they are combining different lasers, energy-based device like radio frequency, microfocus ultrasound. They are combining different injectables, different kind of fillers products, biostimulators, skin quality improvement, skin boosters in one session, right? To achieve the best overall results. In the Southeast Asia country, including in Malaysia, perhaps in Singapore and Philippines as well, we are not there yet, I would say. We are not there yet. But definitely in Korea, it's already a common practice. So I would say it is safe to combine with different energy-based devices, lasers with Juvelook. However, it is still important to consult a trained doctor,
of course,
when you're doing it. Yes.
Okay, so in terms of skin types, who are the patients suitable for Juvelook treatments? Like, is there a skin type that can only be treated, or is it everyone?
With Juvelook, since it's a very versatile product, we mentioned this over and over again, it makes the product suitable for a lot of skin types. It makes it not just for skin types, for multiple indications as well. That's why in the Philippine market, it's very important for the doctor and the patient to meet halfway. Sometimes we have patients who have certain expectations about the product, and as a doctor, it's important for us to make sure that those expectations are realistic. Since unfortunately, this product cannot give you instant results. But the benefit is, if you do multiple sessions, you really see excellent results. So it's a matter of having a journey with your patients, a journey in terms of explaining to them what to expect, what results can come out of it, and meeting them halfway. In the clinic, since we get patients who are very budget conscious, I like giving them options. In a way, I'm able to build a relationship with them, and if you're able to do that, they trust you more, and they trust the decision you make for them, and it makes this process a long-term relationship. And with that, we're able to actually address more indications and more needs later on.
Yeah, so whenever we give presentations about Juvelook, I'll always have that slide about what can Juvelook be used for. Everyone. Number one, younger patients, because rejuvenation, collagen banking, these are all the keywords now in aesthetics. So yes, younger patients can benefit. They can build up their collagen and elastin. And yeah, it's like banking your money, you now bank your collagen. Then you have patients with problem skin, like you mentioned, textural problems, acne, scarring. Yeah, so these patients would definitely benefit from Juvelook because it really improves the skin texture, the pore size, and the scarring. Then next, you have your older patients, those in their 50s, 60s, and so on. And that's where they really want rejuvenation. And Juvelook can do that, because you're stimulating collagen and elastin and fat cells.
What would be a good age to start Juvelook with?
I think as with all aesthetic treatments, the earlier, the better. I don't think there's a right age because every patient is different in terms of budget and also needs and wants. Yeah, but I think anyone can start. But I always tell patients it's always nice to start. The sooner the better.
With regards to skin type, I don't think that there is one particular skin type like what they said. I like what Dr. Michelle said, that it's always a journey with the patients. So when you've handled a patient for a long time, you would more or less have a good grasp of how their skin will react after treatment. So when, for instance, I use a multi-injector machine and the patient is rosacea prone. This rosacea means that the patient gets stingy. They're quite sensitive to certain products. I would advise the patient to pre-treat first. We can prime the skin, moisturize beforehand. Basically, take care of the patient's skin before you can do a multi-injector procedure. So it's not actually product specific. It's actually the method of delivery specific. But like what they said, I can use it in acne scars. I can use it in fine wrinkling. I can use it for just plain rejuvenation. I can combine it with treatments. I can sandwich it between treatments. And I don't see any problem at all with that.
Can it also heal really deep scars?
Okay, with really deep scars, we ask how long the scar has been on the patient's skin, which part of the body is the scar in, what is the color of the scar. Because one treatment is not enough and one sitting is not enough to treat it. I might have to destroy the older fibroblast with a laser first, and then I will use PDLLA after. I will probably prime the skin first with amino acids or with polynucleotides. Then I will do the PDLLA. So depends. It's actually very smart if you can sit down with your doctors first, have a consultation with them, ask whatever issues you think might come up, make the plan before you go ahead with treatment, so that from the start you already would get an idea of how much budget you'll shell out, how much downtime you can afford, what the time frame is. And I like patients who are very participative in their own skincare journey.
results.
Okay, so the moment we've all been waiting for, their verdict about Juvelook.
In summary, I feel that Juvelook is a versatile hybrid skin booster and biostimulator. I feel that it can address many skin types and many skin issues. I feel that it is an injectable that markets itself. And in this aesthetic world of increasing interest in biostimulation and biorevitalization, I feel that Juvelook is an injectable that's way ahead of its game.
I would like to say that PDLLA will make a mark in the shelves of the doctors, and it will not only take up space, but it will take up space with pride, because it has a role in a lot of patients, and its role is very easy to understand, very easy to explain, and it's very versatile. So I can offer it to a lot of patients. The role is not very specific, but patients can easily grasp the idea, and they should be able to pinpoint the changes of the product. So I think when we were talking to Dr. Steph, she said something about it might not be a trend anymore.
Yeah.
I remember that it might not be a trend anymore, and that might really come out true. It's making a mark in the industry, and you cannot discount the fact that the technology itself is well understood. It's simple, it's safe, and people would want to see the effects which they will do.
Since practicing aesthetic medicine for the past decade, I've seen product that comes and goes, get right on certain hypes and goes away. But I feel that Juvelook is here to stay. Juvelook has invested a lot of money into clinical research to show its efficacy, its safety, and I feel that this company continues to invest into groundbreaking work to discover the true benefits of Juvelook. So in my practice, I've seen remarkable results, especially in terms of skin brightening and skin whitening as well for patients, which is not the usual benefits a biostimulator would bring. So I'm very, very excited to see how else Juvelook can open up more wonders to our patients.
It's a definite go for me. Now, I'm very happy that our Filipino patients can now get their hands on the best product in the market today. Not only has it won multiple awards in Korea, there's a lot of innovations. What I like most about this product is every month there's a paper that comes out regarding another indication, another use for Juvelook. So our Filipino patients deserve only the best, and now I'm happy to say that this product is here to stay. It's in a league of its own, and we will see future innovations with this product in the years to come.
We have Doc Michelle, Doc Edmond, Doc Stephanie, and Doc Elaine, and they're saying #1 biostimulator, Juvelook is here to stay. And we hope you check out Juvelook because it will definitely give you that glass skin we've all been wanting. So let's make everyone beautiful.